Hello, good morning, good afternoon, and good evening to everyone joining to WHO's today's live Q&A session on World Obesity Day. My name is Alexandra Kuzmanovic, and I will be the host of the today's session. I am very pleased that I will have three guests today who will be answering your questions. The first guest is my colleague, Dr. Francesca Celletti, who is a WHO Senior Advisor on Obesity. Hello, Francesca. Thank you for your time today.
Hello, everybody. Hello, Alex.
Thank you for joining us. We also have Amber Hewitt Garcia, who is a board member of the World Obesity Federation. And good morning to you, Amber. Thank you for joining us early in the morning, your time.
Yes, thank you for having me.
And last but not least, we have a guest joining us from South Africa, Nomathemba Chandivana, who is a Chief Science Officer from Desmond Tutu Health Foundation. And good afternoon to you, Nomathemba.
Hello, everyone.
Thank you for all of your time today. And before I give the floor to you, I just want to remind our viewers that they can ask their questions about obesity if they are watching us on X using the hashtag AskWHO. If they are watching us on other platforms, Facebook, LinkedIn, or YouTube, they can leave their questions in the comment section. There's a team of colleagues who is monitoring those and will be passing through, and I will pass them on to our guests. And with that, I think, Francesca, I would like to start with you. As I mentioned, today is World Obesity Day. So can you please tell our viewers why are we marking this day?
Thank you, Alex, and greetings to everybody. Indeed, today is we celebrate World Obesity Day for a very good reason. Obesity is a public health crisis, and the number speak extremely clearly on the matter. There are 1.1 billion people living with obesity in the world, including 175 million children and adolescents, in addition to almost 350 million men and around 500 million women presenting with the condition. If you look at the projected trends by 2050, the expectation is that 2.3 billion people will have obesity, again, with higher prevalence in women as compared to men. In addition, obesity is also responsible for almost 10% of all deaths from non-communicable diseases worldwide. And also, let's not forget that the burden of obesity associated disability is extremely high. The cost is also an issue. Global costs are predicted to be at 3 trillion US dollar per year by 2030. And in countries, just to give a much more realistic example, with an obesity prevalence rate of 30%, the disease could absorb up to 18% of national health expenditure, which is big. But what I want to add is that it's not just a matter of numbers. It's also a matter of inequalities. Obesity generates illness, generates disability, social isolation, decreased productivity, school drop-off, job loss, stigmatization, and discrimination. And really, the window of opportunity is between now and 2030 to avoid the catastrophic 2.3 billion estimates by 2050. So really, it's an important day. Let us continue to work on this, and let's do it together.
Thank you so much, Francesca, for giving us this overview. Is actually very, very serious, and it seems to become even a bigger problem in the years to come. So, Nomathemba, maybe coming to you, can you please elaborate a bit more? What is the evidence showing us how obesity is impacting a person's life?
You know, Alex, thanks for that question. And Francesca really laid it out wonderfully for us. You know, these are alarming statistics. and 2030 is literally just around the corner. Obesity is a complex disease that's got a lot of drivers, and it impacts so many aspects. And from a health perspective, is associated with about 200 diseases. Yet the impact, yet we do not treat obesity as a chronic disease. You know, just like we look at type 2 diabetes and other diseases, we are not really looking at obesity as a disease in its own, on its own. And while the evidence is there, I think World Obesity Day is a day that we can refocus, really looking at the theme that's behind me, which is changing systems for healthier lives. That we're doing this to prevent 1.1 billion is a lot of people, but to prevent that from being 2.3 billion people.
Thank you so much, Nomathemba. And going to Amber, maybe from Federation's experience and other people living with obesity experience, why it is important to also treat obesity as a disease and not just as a risk factor to other diseases.
Yeah, we know that obesity is a lifelong chronic complex disease. In the US, it was declared a disease 12 years ago by the American Medical Association. But a lot of the stigma, sort of the conversation globally has been this is a disease of choice that could be managed simply by exercise and diet. And we know that is not true. We are actually not reducing the incidences of premature mortality from NCDs. And I think at the top, we said almost 15% of premature deaths can be linked to high BMI. So it is associated with other diseases, but there is active treatment for it. To consider obesity as a disease means comprehensive treatment from a variety of providers. So it is not just a medical issue. It really affects an entire person's overall health.
Thank you so much, Amber. And we're already starting to get questions from our viewers. And maybe, Francesca, I can address this to you and other guests can complement. We have a viewer from LinkedIn who is saying that childhood obesity is epidemic now, including 6 months old. Obesity should not be treated as social stigma or isolation issue, but more inclusively. And I think it links to what Amber was just saying, but maybe we can say a bit more about childhood obesity as a problem.
Thank you for the question. And indeed, we have been observing increasing rates of obesity in children and adolescents. And the estimates are also saying that this will be even worse in the next coming years. As Amber was pointing out too, and also Nomathemba, the causes of obesity are very diversified and complex. And while, again, starting at individual perspective, it could be a simple issue of an unbalance. There are several balance between the energy intake and the energy spent. There are several things that, including during pregnancy and childhood, can be done to prevent and anticipate children obesity in adolescent. We do know, for example, that breastfeeding is something that is really a very powerful measure to prevent obesity, and breastfeeding as long as possible and at least exclusively for 6 months is critical. It does prevent undernutrition, but also infectious diseases, and it decreases the risk of obesity and other chronic diseases in both children and the mother. Also, we do know that we need to encourage children to be physically active each day of the week through unstructured play, recreation, and leisure activity. And here is where the role of the school is critically important. We also have to empower the new generation of children and adolescents to have skills to be able to make healthy choices for healthy lifestyle behavior. And then we do know that this is a very powerful measure, and we do have the possibility to do so through different approaches, including application of behavioral science and also, as said, the role of the schools. Overall, I like to say that obesity does not affect a single age group or a single country or a single or a males more than women. It's really spread across. And as such, to prevent further increase of the current rates and to keep the current rates under control, we need to apply a multi-sectorial system approach that targets all age groups, starting from transforming the food system so that to expand access to healthy food choices, transform the active environment to provide the possibility to everybody, starting from the children, to move freely and safely and possibly outdoor. And then also the health system can put in place and bring to scale healthcare services to prevent, starting from the pregnancy and delivery and infancy and across the life course, and then progressively treat and provide care for obesity. So it's not a single age, it's not a single age group issues, it's spread across the society, it's spread across incomes, and we do need a system approach based on the multi-sectoriality of the response.
Thank you so. Oh, please go ahead.
And
Please go ahead.
Alex, I just wanted to say, I think Francesca's words are really important. And one thing I wanted to add, childhood obesity is quite prevalent in all areas of the world. We know it's rising rates in low and middle income countries and high income countries. But I think what is important about childhood obesity and why this is an important place for us to intervene, support our children, adolescents, and our communities is that overweight in childhood and adolescence becomes overweight in adulthood. So this is a time that we can foster better behaviors across the spectrum, from increasing physical activity, from making correct food choices or better food choices, I should say. Things like, for example, a lot of parents will put juice in their lunch boxes, but sugar sweetened beverages increase our risk of obesity. And also, the one thing is around direct marketing to children. You are in any supermarket, if you look at what packaging looks like, and it's targeting children, as I call it, the temptation aisle. When you're leaving the supermarket, it's the eye level of children. I have young children myself, so I see what direct marketing to children is, just to put that as part of the conversation.
Thank you so much, Matemba. And we have a lot of follow-up questions from our viewers. Francesca, I would like maybe to take this one first. How does the WHO plan to address childhood obesity in communities with limited access to healthy food choices? It was a question from a Facebook viewer.
Thank you so much. WHO is currently supporting government to put in place transformation across the system that we just mentioned. Specifically, when it comes to the food system, we really have to expand the access to healthier food choices and to make those choices sustainable, as to ensure that children are fed with nutritious and balanced diet. The possibility to do so is both at policy level and also at, let's say, population level. Government, there are, several examples of what we call in WHO best buys, policies that have demonstrated a proven effect to expand access to healthy food choices from a regulatory and legislative point of view. And I just want to provide you some example. For example, regulation of marketing of unhealthy food to children is proven to be a very impactful way to discourage to discourage unhealthy food choices, especially those that Nomatemba was referring about what children like, what do select, what kind of snacks they want, etc., etc. Taxation of sugar sweetened beverages. Again, children consume a high level of sugar through beverages, including beverages that might be assumed to be healthy, like yogurt, like flavored milk, like juices, etc. So the taxation of this product is shown to be very effective in decreasing the purchase and therefore the consumption. We also have and other measures that can be put in place, like, for example, front of pack labeling, telling you whether a product is healthy or not, that might influence the purchasing choice of the mother. So all that is, and there are many countries currently that are putting in place these policies to provide better access to healthy food to their population. At the same time, going back to the prevention measure that as a family can be put in place, are of course starting with the breastfeeding as soon as possible, from delivery, at least exclusively up to 6 months, have a balance, complementary feeding, and encourage physical activity in a recreational way. There's no need to access extremely sophisticated way to do physical activity. Play and run and move is just enough. As limit screen time, ensure that the child has enough sleep of good quality. These are all issues that can be put in place. The health system plays a very important role in supporting families, in putting in place prevention measure. As we were saying, encouraging breastfeeding at each visit, including when the child goes to the health facility for immunization or for a common infection. Make sure that the mother is supported to do so. Educate the mother to provide healthy feeding to the child and the family at large is also very important. And of course, the government can also come back and transform and put in place measures to allow to transform the active environment. It is difficult in certain countries, but it's not impossible. There's a lot of progress in this area. And again, green spaces or ensuring that some of the roads are safe enough to take a walk are enough to encourage that mobility that is necessary. So these are the different options that WHO is supporting countries with. And we've seen extreme progress in this area, and we are continuing to do so and to support the countries to do even more of what is happening today. This is much needed indeed.
Thank you so much, Francesca. We're still getting a lot of questions. So Amber, maybe this one I can give to you. It's coming from Veronica Douglas, who is saying that obesity can be considered a form of malnutrition across the life cycle. So how can one go about to change the mindset of cultural beliefs?
Sorry. So I think I first want to respond to something that I want to put out there, that children are part of environments who are in the adults raising them are a generation, the first generation who have really been educated, that we understood that obesity is a disease. So children certainly have agency, but I think there's a lot of control at a local government level on food systems and environments that we create to support healthy lifestyles, but it's also a public health response. So access to healthy foods, it supports any chronic disease that a community is facing. So can you share your question again, Francesca, that came in?
Francesca Nomatemba, do you have anything to add?
I'm sorry, Alex.
Oh,
Yeah.
sorry. We lost you for a moment.
She was asking for the question around children and obesity and malnutrition across the lifespan.
Yes.
Yeah. So just
Yeah, I was just asking for the question again.
yeah.
Um,
I can read the question again. So, how can one go about to change the mindset of cultural beliefs as obesity can be considered a form of malnutrition across the life cycle?
So I think thinking about obesity is a disease, and so weight is a symptom of that. So malnutrition can um, it impacts weight in both directions. And then I think focusing on obesity is less of uh, sort of excess weight, but how it affects your entire system, right? And I think when we talk to people about, and I think about as a lived experience advocate, focusing less on sort of a BMI, but how do you want to feel? What do you want to do? What is your obesity maybe preventing you from doing? Talking to healthcare providers about the outcomes that you want to see, sort of the life that you want to live, and not focusing solely on weight. So, getting to other factors or other really symptoms of obesity that you want to be addressed.
Thank you so much, Amber. Numatemba, maybe I can give the next question to you that is coming from Stacy Massey. Is most obesity caused by insulin resistance? So I think maybe it would be good as well to speak about, in general, what can cause obesity and what are the risk factors to obesity.
Okay. So as we opened up saying is that obesity is a multifactorial disease that is caused by some genetics, the environment, and this is the built environment and the food environment, and also early childhood. So there are many things that cause obesity. But obesity, if people are familiar with the game called Jenga, where you put tiles on top of each other, obesity would be at the bottom, and then you can put a lot of diseases. So going to type 2 diabetes, which is one of the biggest health emergencies that we're seeing all around the world. In low and middle income countries, high and middle income countries, we've got rapidly rising rates of obesity, of type 2 diabetes. And a lot of that is linked to excess weight. As Amber said earlier, around focusing on health opposed to weight, I think that's a really good framing because it's not about what people who live in bigger bodies would look like. It's actually the health impact and what shortens lives. And diabetes is a difficult disease for many reasons. So as we counsel people or treat people who have obesity, who have type 2 diabetes, we also focus on reducing excess weight as part of the interventions, but it's also diet related. There's medications as well, and also physical exercise, which reduces your risk of type 2 diabetes.
Thank you so much, Namatemba. And Amber, maybe you can share with our viewers what each of us can do to prevent obesity.
So I think prevention of obesity is one starting. I think the basis of any prevention of any chronic disease is the decisions that we make. So it is how much we move our bodies, the food choices that we make, but also finding a medical professional that treats you with dignity and respect. So and who hears you when you go into a medical setting. So as a longtime advocate, making sure that you feel comfortable that you can be honest with your medical provider, and then uh, really examine your entire environment and understand that you have influence over that. So even when if you're in a workplace, an educational setting, understand where you have the opportunity to influence to continue supporting a healthy lifestyle. But prevention too is so much more than personal choice. It is continuing to be a good citizen and and keeping in tune with what your government and local communities are doing to support for your entire community, and the groups that you're a part of. So it is also helping, and becoming an advocate for others around you who may be already living with obesity too. So it is continuing to advocate for treatment, because as you treat adults, and as you treat it seriously as a disease, as a community, and as a country, or as a global community, you influence the health of other people around you. And so that, seeing yourself as part of the solution, even when you're not particularly impacted or living with obesity, is important.
Thank you so much, Amber. And actually, governments have a massive role to play. So, Francesca, maybe you can tell us what governments should be doing to prevent the risks of obesity, but also to support people living with obesity.
Thank you, Alex. In fact, and this is central to the work of WHO, indeed, is really to support government to take action and to change and transform system, and to transform system. As just said before, the individual component does play a very little role in the determination of the condition itself. And we do know that we have to act across the food system, the active environment, and the health system, and not to forget the school setting. That is also extremely important. I already provide example of policy and through regulation and legislation that governments can adopt to make sure that the food environment offers healthier choices to the population across the life course. But just to repeat, regulation of marketing, SSB taxation, front of pack labeling, these are all extremely powerful measures that in fact countries are adopting. The second point that I want to make is the active environment. We do know the challenges, especially in certain parts of the world, to be able to move freely outside in a safely manner. So really, the transformation of the active environment and the availability of green spaces are essential to make sure that people in every village, in every town, in every city have the possibility to move, to walk to work, or fundamentally take a walk. School setting is extremely important. Children and adolescents, we focus on obesity in this age group. Children and adolescents spend most of their weekdays in school, and school has function across a different series of areas. First of all, the procurement of food. The school has the possibility, and their countries adopting this policy, to provide healthy meals, to avoid vending machine with processed food as part of their snacking, to have fresh fruit as part of a midday snack, to ensure and enforce the physical activity to recreation through breaks, through outdoor play, and also have very important role in building the skills in this age group, in this generation, to make healthy choices throughout their life, even when they grow up. Also, the school has also the possibility, for example, to act as public health measure and monitor the growth of the child, and possibly refer that child or that adolescent to the health services is required, monitoring the growth according to the BMI standard. Very important, the health system, and I like to emphasize that the health system transformation and the health system response has been somehow neglected. WHO is putting a lot of emphasis on this area to make sure that across the different age group and following a primary healthcare approach, access to services is provided. Fundamental issues is to increase that access. We do know that is paramount to healthcare access, and delivery of services that are free at the point. Delivery of services that are free at the facility is a critical way to impact the population. Also, another very important factor we talk about the perception around obesity, is to increase. There's a lot of divergence in what obesity is and what it means and the burden it carries. So it's very important to work at societal level to decrease demand for services, not only in this health system, but also to increase demand from us for access to healthy food, for access to healthy walking, etc., etc., etc. So this is really the work the WHO is doing, currently focusing on a subset of countries, which are 34, but across in specifically intensive manner, but working across all member states to put these policies in place.
Thank you so much, Francesca. And I see that we have some new viewers joining from South Africa. So, Matemba, maybe I can ask you to share some of the efforts in South Africa to mitigate some of the risks to obesity.
Okay, thanks for that. Actually, there was a question that I saw which was making a comparison between HIV and obesity. So South Africa's got some of the highest rates of obesity, both in adults and children, and rapidly growing rates. And this is a country example of what could work in different countries because the obesity epidemic is different in different countries based on your epidemiological transition and so forth. So this is a country example from South Africa. And we also have some of the highest HIV rates in the world as well. But we've learned a lot from HIV. One, we've understood the healthcare system. We've been able to work together across sectors. So both the community, healthcare researchers, healthcare workers, and also our governments as well, how to work together. And the levers that we've been able to pull in HIV, I think, can be directly an example for the obesity crisis which we're working on. So the first one would be you can't treat your way out of any epidemic. So treatments are great, but they have to be in an enabling environment. So what we did for HIV is working with communities, working on stigma. And just as we have HIV related stigma, we also have weight related stigma. That's really important. The training, it can't be training just for doctors or in hospitals. It has to be training around obesity as a disease all throughout, from the community, in schools and healthcare settings, and also within other places that are outside of health. And the third lever, which I think is important, is that community engagement. That is really, really important because in South Africa, the HIV movement was really led by communities. And for obesity, we need to do the same.
Thank you so much, Nomatemba. I'm actually glad you brought that link with HIV, a response in South Africa, because we did have a question from Hina Kauser, who's asked a few times, why can't we conquer obesity like we've conquered HIV in some places? And maybe Amber, you can start with that, and other guests can complement.
When we've looked at non-communicable diseases, and I think that's an opportunity that we have this year, is that we've actually not prioritized obesity when it is linked to other non-communicable diseases. But we don't have we have a mindset around obesity as a disease of choice. And so while we those personal circumstances, sort of the decisions that we make go into that, but we have to have those environments and active treatment when it comes to obesity. So if you were living with diabetes and walked into a healthcare provider's office with an A1C of 7 or 8, you wouldn't tell them just to eat better and move more. You would provide active treatment. But people with obesity walk into doctors' offices every day, half of which are actually never receive a formal diagnosis. So they certainly don't get to active treatment. And then the stigma and bias that people are living with who are affected by obesity, the messages they hear, they believe that. So when they go into a healthcare provider's office, that advocacy, that feelings of shame and blame are often present. so they don't bring it up with their healthcare providers as well. So we when you have to believe that you're worthy of treatment, and you have to be aware that it exists. So I think it's both of those things. So when you put all of your resources and you have a coordinated effort, you can make progress on it. But we are really just now seeing a shift in the last decade, and I would argue in the last 5 years, as we've seen more effective treatments come on the market. I would say when I started advocating 16 years ago, those didn't exist. I'm someone maintaining a 245-pound weight loss, and I come from generational obesity. Every single person in my family is affected by it, but they're also from generations for which treatment did not exist. And so if you it is hard to reduce the prevalence of something when you haven't had the tools to combat it. And so now I think we're entering a new era where we both have increased political will, access, coverage, but we're also actively taking on weight bias and stigma, and how that is impeding our health and the care that we are getting as individuals, as family units, and really as communities. So I think we can make progress, but we all have to believe that this is a disease that is manageable, and it is not often one thing; it is many things at once. So I think taking the lessons learned from all of the systems that had to be working together can be applied to obesity.
Thank you so much, Amber. And I'm glad you mentioned treatments, because Francesca, there's one question I wanted to ask about treatments for obesity, and in particular about the GLP-1 obesity medication, as some people are claiming that these are or will be the game changer. So can you tell us what is the WHO advice when it comes to obesity treatments?
Absolutely. And the new class of GLP-1 receptor agonist represent indeed an additional tool in the management of people with obesity. There are several studies that are showing that in a range of people, there is an important reduction of weight, but not only. There's also an important reduction of prevalence of associated comorbidities that frequently come with obesity, like hypertension, like hyperglycemia, diabetes, cardiovascular diseases, among others. These drugs were approved for the obesity management in 2021, that is called semaglutide, and in 2023, called tirzepatide, a second formulation by the FDA and by other regulatory agencies. However, we need, right now, it is true that health systems across the globe might be able to offer a treatment response that has to be integrated with lifestyle changes. Going back to what we were saying earlier, we know that obesity is a complex chronic disease, and they are caused by a variety of determinants, and that demands a social, a public health, and a clinical response. Medication in isolation will not be enough to address this obesity crisis. It's very imperative to deliver a health system response that integrates lifestyle changes, but also make sure that the services provided are available, accessible, affordable, and sustainable. Affordable access to any medication is paramount to enable people with the best possible care, and we are not there yet. So WHO is currently developing guidelines on the use of GLP-1 in adults with obesity, reviewing all the evidence, and that will be further analyzed by a group of external experts that will make recommendation on the clinical indication of this medication. But not only, they also will take into consideration the issue that we mentioned, like the acceptability, the cost, the equity, the scalability, whether people will, or government, for what matters, will be able to include those medications free at the point of delivery. So also, WHO is also developing guidelines for the clinical management of obesity in children and adolescents, and pharmacological intervention are being evaluated. So just to summarize, it is an additional tool. It can't be used in isolation, and alone will not solve the obesity crisis, but can be, it has proven to be efficacious in the reduction of weight and in the reduction of obesity associated comorbidities.
Thank you so much, Francesca. I think there was a lot of interest on this question in particular. And I know we are running out of time, so I'm going to try to wrap up maybe with a few final questions. And I know that this one is quite important because a lot of people living with obesity have been facing discrimination and stigma. So Nomathemba and Amber, maybe I'm going to start with you to share your advice on how we can actually stand up to stigma and discrimination in this field.
Yeah. So I think there's a couple of things that you can focus on. First, look at the language that you use when you're speaking about obesity. So we still see terminology like obese person, and what we call and shifting that to what we call people first language. They are not their disease. So putting the person first. And the way that you speak about something matters. And then also look at the imagery that is associated with obesity. So if you see a news article or a research paper or even a social media post, is the image stigmatizing? Is it someone headless who is implying that we should be ashamed to be identified? Are they, gluttonously eating, which reinforces that this is a choice? And use things like our imagery database. So organizations like Obesity Action Coalition, Obesity Canada, ECPO, all have free image galleries for non-commercial use. So encourage those publishers and journalists to use positive imagery associated with obesity. So the way that we speak about it, and then the way that, the images associated. And then also, if you look at stopweightbias.com, you can look at all the ways it shows up in healthcare, education, workplace, not just the language that we use and images we see. Are you a medical provider who has chairs that accommodate a person living in a larger body? Do you have the facilities and equipment to treat someone? Are you creating an environment where people feel like they can get care? So you can really look at comprehensively. Are you providing a supportive environment for people who are affected by obesity?
Thank you so much, Amber. And Nomathemba, what are your thoughts?
And everything that Amber said, and a little bit more, particularly from me as a healthcare worker, is around what language are we speaking when, people first language is really important. Even the setup of our healthcare facilities, and are we meeting people where they are? I think that's really, really important, because obesity is one of the few diseases that people living with obesity feel like they have to deal with on their own. And often it's because healthcare workers and healthcare providers don't open up that conversation. So do not be afraid as a healthcare worker to start that conversation, but in a respectful manner and with dignity, because that's really, really important. And also outside of healthcare facilities, how are we approaching obesity, both from a prevention point of view and from a treatment point of view? I'll give you an example of, do we have chairs that can accommodate different body sizes and so forth? Do we have BP cuffs? So those are some of the things that I think are really important to really reduce weight stigma in our healthcare facilities.
Thank you so much. And maybe, Francesca, last but not least, what is WHO doing to stand up to stigma and discrimination when it comes to obesity?
Thank you, Alex. And what I like to address very briefly is, the issue of non-discrimination is one of the guiding principles across all WHO work. Today, I just want to give you an example. We launched a product that is called the WHO Technical Package to Stop Obesity. And when I was describing in a previous webinar the methodology. I went through this guiding principle because these are very important. And one of them is really the principle of equality and non-discrimination. We are very determined, as to the right of enjoyment of the highest possible level of health, exercised through a non-discriminatory, comprehensive approach that is not on the basis of gender, of age, of religion, of nationality, race, and in specific case of weight or lifestyle choices, and etc. Nevertheless, we do see that stigma and discrimination in the case of obesity are present across the life course. We see it in families, we see it in school, we see it in workplaces. As Noma Temba was saying, we also see it in health facilities sometimes. Uh, a very important consequence of this is also the fact that people that go through stigma and discrimination can really and have an impact on decreasing the demand of services. Services, as we were saying, not only in the health system, people don't go to facility when they are supposed to do so, but also decrease the demand of a transformation of other system and really push the government, as we've seen in other diseases, to put in place the necessary process. But it's possible to fight stigma and discrimination. We cited the example of HIV. So much progress was achieved in this area as in other diseases. So I'm very confident that we will get there with through the empowerment of a community, through the empowerment of the people living with obesity, and really engaging them from the start in the development and implementation of policies across sector. So hope is there, and this will decrease.
Thank you very much. I think it's important really to end this conversation on the hopeful tone. And I do want to thank you once again for your time and for taking the questions from our viewers. And also thanks to all our viewers who are watching us today from Angola, Tanzania, the US, Bangladesh, Indonesia, Mozambique, Canada, Switzerland, Uganda, DRC, Ghana, Kazakhstan, Lesotho, India, Liberia, Iran, Senegal, Pakistan, Nigeria, Egypt, South Korea, Brazil, Guinea, Qatar, Germany, Italy, and Togo. Thank you all for your time today. Thank you for your interest in this subject. There was quite a lot of interesting and helpful questions and comments. Please continue to follow our social media channels for updates on this topic today and any other day. There's also a lot of resources on our website. So please follow those and take care of yourself and those around you. And until next time, goodbye.